Hello, I'm Selena Gore, the CEO of WomenHeart. Today, we'll be talking about cholesterol management and what women need to know to take care of their heart health. Thank you all for joining us. For those of you who are with us for the first time, WomenHeart is the nation's only patient-centered organization focused solely on women with heart disease. We provide support, education, and advocacy for women living with and at risk of heart disease. And we engage a strong volunteer force of women across the country with heart disease known as WomenHeart Champions. And you will meet two today. So I want to start by introducing Vicky and Deborah. And what I'd love to do is invite Deborah to share your story of your heart journey.
Great. Well, thank you, Selena. And I appreciate the opportunity to share just a little bit about my story. It actually began about 11 years ago. Back in September of 2009 was a beautiful fall day, and had thought, I was relatively healthy, and turns out that after dismissing increased heartburn, jaw ache, shortness of breath when I was walking up 15 stairs, thought it was time to go see a doctor, and did go see one, and immediately went to the emergency room and was worked up, and they diagnosed a heart attack, and I had a catheterization, and now I have 2 stents in my right coronary artery. I've been pleased to have good care along the way. And WomenHeart was introduced to me actually immediately when I was in the hospital.
Oh,
So,
wow. Was that by your cardiologist?
It was by my cardiologist.
Oh,
yeah.
wonderful.
They approached me in the hospital to consider participating in a clinical trial.
Okay.
It was designed at that time. I was 48 when this happened back in 2009. So you could probably figure out how old I am now. But yes, my cardiologist came to the room with the nurse practitioner, asked if I'd participate in a clinical trial, which I did. And then that got me introduced to WomenHeart, and just immediately felt the need to share my story. Because if I felt like I had gone through something that I wasn't really terribly familiar with, then probably there's other women that were in a similar situation. So
absolutely. And just to ask a little bit further, Deborah, what motivated you to join WomenHeart? I know that it's often this need to give back, this need to provide support to other women, but were you looking to make sure that other women similar to you didn't go through that journey alone, or were you looking more to prevent other women from experiencing the same thing?
Yeah, good question. I think my primary motivation was raising awareness, letting, reminding women that they need to take care of themselves from a heart perspective, in addition to, a number of other things we need to take care of as well.
Yeah.
But awareness was the big thing. Letting women know that they need to be aware of their cardiac risk factors and maybe some family history, and knowing their numbers, and because those were all things that I wasn't on top of. And I felt like if there was just some opportunity to, again, raise awareness was the primary motivation. And
great. Yeah, and we'll come back to how cholesterol sort of played into your heart disease. But first, I want to go to Vicky and ask for you to share your story.
Sure. Well, hi everyone. My name is Vicky Saul, and I live in San Jose, California. I had my heart attack in 2013 at the age of 53. At that time, I was diagnosed with something called SCAD, which stands for spontaneous coronary artery dissection, for those of you not familiar with SCAD. And what happens with SCAD is that there's a tear that occurs in the lining of the artery. They still don't know what really causes the tear in people, but as the blood is flowing through your artery, some of it gets behind that tear, and it starts pushing the a flap. Think of a flap of your skin, pushing it into the artery. And that's what caused my blockage. That's what caused my heart attack. I had 2 dissections, one in each of 2 arteries, and I had stents placed in one of my arteries. I had a very fast recovery. I was back to work in a week, doing my exercises, leading a full life. But then 7 months later, my stents failed, and they discovered at the time that I was resistant to the blood thinners I was on. So I had a few more stents placed in one of my arteries. They switched up my blood thinners. And since then, you know, knock on wood, I've been healthy. I've had a full recovery, and I really am thankful, and I feel very grateful because I had great cardiologists, and I was at a top-notch hospital with amazing nurses and caregivers.
Amazing. Your stories both are just sort of breathtaking, really, considering how else it could have gone. But you know, you've managed to not just survive but thrive. And you know, you mentioned outstanding cardiologists, and I feel like Dr. Gulati has appeared on cue. We are joined this afternoon by a very esteemed cardiologist, Dr. Martha Golotti, who is the editor-in-chief of Cardio Smart. It's an online patient engagement program which is hosted by the American College of Cardiology. Dr. Gulati is a steadfast leader in patient education and empowerment, and continues to be at the forefront of policy and practice, especially when we consider this specific issues surrounding women living with or at risk of heart disease. She's a beloved member of the WomenHeart Scientific Advisory Council and a recipient of the 2020 Wenger Awards for Excellence in Medical Leadership. So we're thrilled to have you here, Dr. Gulati. And as I said, this is, you know, you couldn't have arrived at a better time. We heard the heart stories of both Deborah and Vicky, and we were about to enter into a conversation about cholesterol. So I think it'd be great to hear from you. You know, what do we mean exactly when we talk about cholesterol? We know there's good cholesterol, there's bad cholesterol, and we know, we've heard multiple times that we should know our numbers. So it'd be great to hear from you as to what that means exactly. Can you break that down for us?
Sure. Well, thank you for having me. And I will say that cholesterol is probably one of the most important parts of our risk assessment. Saying that somebody is at risk or not does require us to know their cholesterol. Cholesterol is the fat that floats around in our body essentially, and it has, you know, good properties too. I don't want you to get the idea that all cholesterol is bad, but when we have too much cholesterol, it does tend to be what gets laid down in our arteries and cause blockages. And yes, it's important to know your numbers, of course, because if you don't know your cholesterol and if you don't know the breakdown of it, you won't really know if it's really okay. So I always try to get my patients to know what their cholesterol is so that they can rhyme them off as well and understand which component is the most important. So you usually get your total cholesterol number, and then you will always get a breakdown too. The total cholesterol is composed of your LDL, which is a bad cholesterol. The way that I remember it is L for lower the better. HDL is your good cholesterol, and H, higher the better. And then triglycerides are just bad. They kind of sound bad, but they are the little fat that floats around in your body as well. And you'll get all those numbers of all of them. The one that you must ask about and want to know more than just your total cholesterol is your LDL. It's the bad cholesterol. It's the target of our therapies. It's what we're watching as cardiologists or as doctors. We should all be having that in our eyes first and foremost. It's not to say the other ones aren't important, but women in particular, one big issue is our good cholesterol. The HDL tends to be higher. It's not true in everyone, but it tends to be higher, especially before we hit menopause. If it tends to be higher and people see a high total cholesterol, often it gets attributed because you have good cholesterol. Well, that's fine, but what if the LDL is bad? And we used to say, oh, you're protected by your good cholesterol. you know what, we don't have that evidence anymore that you're necessarily protected if you have a very elevated LDL. So start at least knowing your LDL, and then that will break down the conversation of what your whole panel means. And whether they give you a copy, whether you're on your electronic records and you can see your cholesterol, maybe write it down somewhere, make a flow chart, kind of find out about it, talk with your doctor. Is this normal? Because sometimes for a man, they might treat it, and for a woman, for unknown reasons, they don't treat it. And we don't have a sex difference in our threshold per se to treat.
Well, that is all such interesting information. I've had that experience, in fact, Dr. Gulati, where my overall cholesterol is high, but it was because of my high HDL with low LDL. So I understand exactly what you mean. And so you kind of alluded to some differences in terms of treatment between men and women. But is there anything else that is especially important for women to know and pay attention to when it comes to their cholesterol?
Well, the most important thing once you know the cholesterol then is that you know what your risk for heart disease is. Women if they go for breast cancer screening, right, you usually know it's either normal or not normal. There's no sort of in between. I wish there was an easy sort of cardiac mammogram for women where you could just simply know am I okay or am I not okay? Unfortunately, heart disease isn't quite like that. It's a probability, of you getting heart disease. And those people that we determine to be higher risk need more aggressive therapy. It doesn't mean that everyone who's higher risk is going to go on and have heart disease, but based on our population data, we know that more people are more likely to get heart disease. So you got to use those odds to make decisions about what you want to do. So I really suggest that you talk when you visit with your doctor. What is my short-term risk of getting heart disease? So what's the next 10 years risk of it? And then what's my lifetime risk for heart disease? And if you already have heart disease, like both of you here are saying, like, that's very different. What's my goal? Like, where do I need to be at? How low does this cholesterol need to be? How good does my blood sugars need to be? How good does my blood pressure need to be? All those things are important. Once you have some information, you're better empowered to actually then have those discussions, be able to participate in shared decision making about your therapy, and have those conversations about what drugs work, what are the side effects, what, does this fit for me, even the frequency or the time of day that you might ask me to take this medication. It works for some, it doesn't work for all. And we're living in a really fantastic time that we are where we have so many therapies now. So if one doesn't fit somebody, guess what? We're at such a lucky time, actually, where we have other choices. So you don't have to be even just worried. I know there's a lot of things out there about statins, and people often don't like statins, and we can work with you. So that's a good thing. We have other things if statins don't work for you, and lifestyle should always be a component anyway, first and foremost.
And, it sounds to me like one of the things that might be different between men and women, Dr. Gulati, is that if for some reason women are less likely to be, their cholesterol is less likely to be addressed, it sounds like women in particular need to bring it up with their physician, with their cardiologist. Is that a fair statement, to make sure that is a regular conversation that you have?
Exactly. It's the one thing men always get their conversation about. And for women, we focus, I always say, to quote Dr. Wanger, we focus on the breasts and the reproductive system, and we ignore the rest of a woman when we're talking about women's health. And so that sometimes gets forgotten in the, quick 20-minute, 15-minute visit with your doctor. You should set a time to just talk about your heart and to know where things are. And the other thing is to not just accept my cholesterol's normal. I want to know what, especially the LDL, is it normal? Because that will make the doctor even look at it. I think our medical community still doesn't view women at risk for heart disease in the same way that they do men. I jokingly say this, and I sorry if it comes off badly, but sometimes men go into the emergency room and, they've hammered a nail into their foot or wherever they, their nail gun went off, and they still get an EKG, and women don't. And it's just like, it's similar to how we even view screening for heart disease. Men get it all the time, and women often don't even know if they're at risk.
Yeah, it is incredible. And talk to me a little bit about high cholesterol and the kind of interaction between that and other health issues, other comorbidities. One might have high cholesterol and diabetes, or one might know that they have a family history of heart disease, or maybe they're a smoker or a past smoker. Are there special additional considerations for those folks that might see kind of a double or perhaps even a triple sort of layer of diagnosis?
Well, they're all important, right? Because first of all, family history always matters. It may make us have a heightened awareness or an earlier point that we check your cholesterol for a woman. We do recommend that everybody at the age of 20 at least know what their cholesterol is. If you tend to be normal at that age, your doctor might decide when is the next time for a screening. Does it need to be every year, or can it be, more like every 5 years, and just make sure that other risk factors don't change over time. But when you have multiple risk factors, so when you're a diabetic or when you're a smoker, etc., those things really do matter. And as we age sadly is a risk factor. So our risk for heart disease goes up, and it will always push you into a different area of concern. And then there's things that are unique for women. When we take into account your risk score, there's things called risk enhancers that were introduced in 2018, and I think many of them are female specific. Some of them are racial specific, like South Asians, Blacks are more likely to get heart disease, but female specific are things that happen to us during pregnancy, being on hormone replacement therapy, going through menopause, etc., etc. And that's where the conversation needs to go for many women. They may appear low risk. You might put them into the risk calculator. No, they don't need cholesterol's fine. We don't need to do anything. But if you don't ask those other questions, so if we don't say, well, what's your family history? Anybody who in your family who died at a young age, if I don't know that you had gestational diabetes, I'm not going to identify you as somebody who's at higher risk.
Right. Now, sort of to place us in this present moment, we know that knowing your numbers is really important, but that involves a blood test often to determine what our cholesterol numbers are. And yet there's a lot of, I think, hesitation to go into clinical settings these days for fear of exposure to COVID-19. So I wanted to get your take on what would you advise women who may be scared to go into the hospital setting, but probably should be getting their numbers checked?
Yeah, I think there was a misplaced fear in hospitals. When we told you all to stay at home, what we meant is we were overwhelmed with taking care of very sick patients in the hospital, not in our clinics. And it was probably a bit of a rollout mistake because it did really scare people. They just thought healthcare setting was full of COVID. You couldn't be in a safer place. We clean our clinics like nobody's business. We don't even let people into our waiting rooms anymore to sit out in your car, and then we'll call you in and you come in, and then your room's sterilized before you can even get in there. So I would just ask you to not put off anymore your doctor visits. Now, there's a lot of options. You could go, and if you're due for blood work, you can go get blood work. Again, those settings are incredibly safe and sterile and clean. we're taking more precautions than when you go into the grocery store. So if you go get groceries, you can go get your blood work. But you can, most doctors now, we're offering televisits. So if you make sure your doctor gets your blood work, you don't have to necessarily go in. Maybe you can chat via phone or by different telehealth systems. I don't even know all the names of them these days because we keep getting new ones every day. So that is an option if you don't want to go in, but I would just advise you, don't be scared and don't put off your doctor visits too much longer. We initially thought, well, if we could keep the system kind of down for 3 months, it might help our doctors be available for what we needed in the hospital. But at this point, it's too much to be putting off. I think even me as a consumer of healthcare, I've decided I've put off everything this year. We've got to go in and get our routine screening, or if you were just due for blood work, or you want to make sure the medications you're taking are safe for still. Drugs have side effects. You might have changed. Things may have changed for you. You know, we've also, during this time of COVID, we have all have more sedentary behaviors, more stress for sure. So we all, things might have changed that you don't even realize, because if you're wearing sweats, you're not going to notice that your pants might not fit. And so you might have not been motivated to get on the scale and know that maybe you've gained some weight, maybe your cholesterol's higher, maybe your blood pressure's higher. And so again, I just, think about how long it's been since you last visited your doctor and try to get on their schedule again. I would say that it's so safe. We wear masks obviously all the time, but we were even advised by our hospital to wear shields, to wear gowns, to still space out everything, to minimize physical exam unless it really was going to be patient and change something. Encourage them, if physical exam wasn't needed, to call in. So there's a lot of options. It's going to change how we're going to take care of you forever. So
Absolutely.
On time, right? Or at least your time won't be wasted as much waiting in our waiting rooms.
And actually on that point of access and back to the doctors, we know for sure that during this pandemic, we have seen a stark kind of highlighting of the health disparities across different communities. And obviously that plays a direct role into whether an individual is able to access healthcare, let alone quality healthcare. So for those women who may not have access to health insurance or face other similar barriers to healthcare, what would you say? What would you advise them about prevention, managing cholesterol, knowing your numbers?
Yeah, that's a little bit harder. I mean, it has been a good wake-up call to our health system about, the people that are already most disadvantaged have less access to healthcare. I still, it's hard to say where can you go in times of COVID for free screenings. People aren't doing those anymore the way they used to be able to maybe go to health or go to community events where we would screen. If you really haven't been screened, though, I would say to go either to your county hospital and see if you can get a screening there. If you have a county hospital, I would say that's probably the one place that it will be free. And that those right now, the harder things. I would say that you can watch the salt that watch your weight, try to deal with your stress, try to exercise every day, do something despite this, whether it's in your own home. Other parts of the country might have snow and you might be scared of going up and stairs many times. If you can go outside, go outside and walk. Think about your heart still. Our lives are going to go back to normal soon. I mean, I really feel as a physician that I'm optimistic. We're going through right now while I say that, but we have a vaccine. We have more than one vaccine to help people and our world safer by the way we used to know. But in this time, take care of you. Don't give up hope. If you haven't got your flu vaccine, I strongly to say that before, make sure you go get your flu vaccine, because if you got COVID and the flu, we think that the risk is even greater of being very susceptible. So if you've done nothing else, see if you can go into either a walk-in clinic or to your own doctor and just get the flu shot. They're out there. It's not too late. October is the month we get it, but during the entire flu season, so until almost the end of March, get sooner the better, though, in this year, I would say.
And I've got a question here from the audience that I'm going to ask, and then I want to bring back a conversation about their cholesterol management. But the question is true that once you're on a statin, you need to stay on it for life, and it's something women should consider before deciding to start a statin?
Well, once you're on a statin, most likely, unless you do something dramatic, either with your lifestyle or something changes in your overall health, most likely, yes.
And when you say dramatic, that means like becoming vegan, for example, or something like that.
Like if if you lose a lot, if it's a ton of risk factors that caused your cholesterol to be elevated, then yes, there is people that I've recommended treatment, and then they do all kinds of things to be healthier. It's the rare person, but I'm always motivated with them to do that. And sometimes I'll even wait to start a statin on them to give them a chance to show me what they can do. But I don't think you need to be scared of a statin first and foremost, because if you've never been on it, you don't know, you might be, it has a bad rap, poor statins. They need a better PR agent, but you don't know if you're going to have any problem with it. So I'd be open to trying it. And if you end up getting side effects from it, then just know there's other options. But I don't think you should dismiss it right out of hand. Now, if you have concerns, like if everyone in your family was on a certain statin and all had the same side effect, I actually take that very seriously. I usually won't start them on that particular statin, or I'll ask them to go call every family member to ensure was it all on simvastatin, and okay, we're going to choose a atorvastatin instead, or something like that. But not to dismiss it out of hand. Although I do think, again, from primary prevention, not like before you have cardiovascular disease, that there's always an opportunity to see what lifestyle can do, because it can empower you. I have had patients that have gone vegan or vegetarian. They've cut certain things out of their diet. They started exercising, whatever it was that they did, where we reassessed them. Their cholesterol was so much better. We could see it was a big part of lifestyle. And we didn't have to start a statin on them. Revisiting them, it was important, because for almost 50% of those patients, I would say they were good for a while, and then they weren't so good. Some people really stuck with it and understood that this was the difference between a medication and no medication. But sometimes we get complacent a little, and then or life happens, COVID happens, things happen. And we eat differently, or we aren't able to get exercise in our lives, or many different things can happen.
Absolutely. I'd love to bring Deborah and Vicki back into the conversation. And with Deborah, can you tell us a little bit about your journey with cholesterol management, given everything we've just heard about? Is your cholesterol something you paid attention to before heart disease? And what's it like since trying to manage your numbers?
Great, thank you. Yeah, prior to my heart attack, no, I really didn't pay attention to my cholesterol. And more importantly, as Dr. mentioned, I didn't really pay much attention to the LDL or the HDL. Back then I thought, here's my total number, good, bad, and kind of moved on. So I totally understand now the value of both of those numbers in addition to the total. Immediately after my heart event, I was placed on a statin. Over 11 years since my heart event, I would say that I've been on 4 statins because I have experienced myalgia or they didn't produce the results that we were looking for. I got to a point where there was one statin that I could take, but it was at the lowest dosage every other day, and I was still getting myalgia. So that's gone. I no longer am on a statin. Instead, now I'm on an injectable and I take that every 2 weeks. And that is, I've only been on it for about 6 months, but within the first 60 days, my LDL doctor dropped 100 points.
My goodness.
So I was like,
amazing.
wow. I called
Yeah.
the doctor. I said, is this number even like normal? He said, yeah, that's actually where we would ideally like most people to be at. So that medication is seemingly effective. The jury is still out for me on whether that's also producing some myelin.
Side effects. Right, right. And Vicki, same question to you. Did you manage your cholesterol before your heart disease? And what does it look like since then?
Yeah, sure. For me, I was vaguely aware of my cholesterol before my heart event. I've always been on the high side of normal when it came to my cholesterol levels, but because I'm always so healthy, my doctor and I decided we would just, keep watching it.
Yeah.
And so I have always had a very healthy diet. I'm not vegetarian, but I've not really eat a lot of meat. I'm not a big meat eater. I don't eat junk food, never have. Not a drinker, not a smoker. So I, just inheritance, played a role here. Once I did have my heart attack, I was placed on statins, just like Deborah. And I'm an avid exerciser. So I was experiencing a lot of muscle pain when exercising. I did talk to my cardiologist, who was also an avid exerciser and understood the importance of sports and activity in my life. So we switched to a different statin, and it made a huge difference.
Wow.
I really experienced little or no muscle pain when exercising. And my cardiologist also suggested that I take an enzyme supplement, CoQ10, to also help combat the muscle pain. So I was lucky.
And Vicki, so since then, have you been able to continue exercising? And assuming you've also kept up your healthy diet as you've gone on.
Yes, I have continued to exercise. And I also suggest to folks who are out there who may be on statins and experiencing muscle pain, just have a discussion with your doctor. I know that there are a lot of statins out there, so I was lucky to be able to switch, and it made a huge difference. In terms of my diet, I am a lot more, I know what my numbers are. Before my heart event, I have no idea what my numbers were, but I do know what they are. And I have made changes in my diet. I've tried to reduce the amount of dairy I consume. Now, I'm a huge cheese lover, so that's been tough for me, but I've swapped out milk, even just 2% milk. I drink soy milk and have for, since my heart event. I do try to cut down on my cheese, and I'm really just more aware of how consuming animal products affect my cholesterol and my overall health. And so I've just tried to make adjustments whenever possible.
Dr. Gulati, I'd love to bring you back into this. And you did mention earlier the important role of lifestyle changes and the potential and the power of that to really have a significant impact in terms of lowering your bad cholesterol. And of course, it's not all about medication, but what do you, especially during this time where we have to stay indoors, or, we're not getting to be winter, it's getting cold, and yes, you can walk the stairs in your home if you have stairs in your home, but what other suggestions might you have in terms of, some of us have limited space, or we can't sort of be outside or be as social or as active as we would like to be. What tips might you offer?
Yeah, so, there's a lot of great things. Glad we aren't in a pandemic in the early 1900s, because, you could do workouts. So this morning, a couple hours before this, I actually worked out with my friend we FaceTime every Tuesday and Thursday. And basically I do a bar class before I sit down and start working all day.
Wow.
And we do that all the time. And so depending on what everybody has a different setup. There's some things though that are free online that you can do. There's even on the New York Times has an app that gives you a quick workout and uses every muscle in the body, or quite a few muscles in the body. You can do that. It'll speak to you and make you change it. I used to do that in hotel rooms in the days when we traveled. If nothing else, it would at least help get you moving a bit. So if you're lucky and you have exercise equipment that the laundry is holding, you should be using it. But trying to find some way to raise your heart rate every day, that's yoga, was stretching, was something on, and you might not even know Zumba classes and things that you can do in the pleasure of your own house. If your children are using like a PlayStation, they actually have an exercise that you can do as a family, and dancing that you can do as a family, or even sports that you can do on PlayStations. I don't have a PlayStation, I just see all the videos for that. But listen, if it gets us off the couch, it's a good thing. And you can even do sort of challenges, whether you're working at home, you can try to raise yourself, and so that you're not sitting all day, lifting up, and just standing is better than sitting, in my opinion. But even as a family, if you're watching, I think a lot of us have spent a lot of hours in front of the TV. And so maybe making it so that you do some other activity, or when you do that, if there is only one exercise machine, that at every commercial, somebody has to do the exercise at that time.
Yeah.
Just be creative and try to make our life more interesting and fun, and not as boring, as I know sometimes people are feeling like. I hear it from all my friends, when is this going to end? It will, but right now we've got to still take care of ourselves. If I could just comment though on Vicky's great point about, and actually both of them had issues with statins. So, it is so much more common to see it in women, the statin intolerance. And then Vicky said she's an exerciser, and I'm also someone who loves exercising, so I completely relate. And we know that with people that are more regularly exercising, they are more likely to have muscle aches. And we don't want to give you something that's going to make you not be active. So it's, just know we have many different statins, first of all, out there. But as I said, and as you've heard already, there's other medications that can be given if you're really someone who doesn't tolerate a statin. We do try things. We try low dose statins, as you heard, maybe every other day. I had some people who just take a statin a week because that's all they can tolerate. And I'm good with it. I'll give them something else to get them to goal. But we were even having trouble getting sometimes these newer drugs like PCSK9 inhibitors even approved by insurance. So we would take what we can. Now the PCSK9 inhibitors are great because some are injected every month or every 2 weeks, and that can make a big difference. They tend to have less side effects, although as you already heard, people may have still side effects to it, so it's not completely normal. We have a new drug that might be coming out that may be injected once a year. So that, that's really exciting for us. We live in a really exciting time where we are going to have more drugs for our patients. But one thing I also often do if you don't tolerate statin is I will check your vitamin D level. And if your vitamin D level is low, I'm not a big believer of just supplementing your vitamin D based on it being low. There's no data to support that. But with statin intolerance, we do see that people with low vitamin D, if we replete it, they are better able to tolerate the statin. So sometimes we'll do that as well. So talk with your doctor, or if you know that you have that issue, it might be the reason. Coenzyme Q10, I try it. The evidence doesn't fully support it, but I'm always game to try it if that makes someone be able to tolerate their statin. We know that statins do deplete coenzyme Q10, which is where that theory came up from, that we should give it back. It might be more intracellular rather than in our system. So there's a little, but it's worth trying. Again, it doesn't seem to have any harm. And if it helps somebody to keep on their drug, that's great. But it is our athletes, Vicki, that we have more problem. And I can't live without my daily run. So I'm never going to be the reason you stop exercising.
Well, and to that point, Dr. Gulati, I mean, to me, all of this conversation just reinforces the point that we really should be going to our doctors, right? Like that is something that you shouldn't avoid today, right? You should be trying out the drugs that make sense for you, but you should also be making sure that, you know, you're given the okay by your doctors to exercise, right? You always get that warning before every, you know, YouTube class or whatever. You know, make sure your doctor, you know, you check with the doctor to go forward. And I think that's a really important part of the conversation, that it's not just about getting your cholesterol tested. It's also about making sure you're fit and you're well enough to do these things that are really important to make sure that your heart is healthy.
Listen, soon we'll all have aged a year since this all started. So at the very least, maybe our risk factors are just a little bit higher, our cholesterol's higher, our blood pressure's higher. We know these things go up with age. Therefore, our age goes up. That's part of your risk score. So maybe just even that reason alone, we all need a check-in. And if you missed it, it's like my bad hair that I'm watching here. If you missed your hair appointment pre-COVID, then you're going to live with the bad hair. Well, you don't need to do that for your heart, and you shouldn't do it for your heart.
That's right. And it's not. I think we need to get away from the mentality that you should only go to the doctor for an emergency.
Yeah,
I think that's the right. That's the big overarching message, right, around managing your health.
Yeah, go to your doctor when you're healthy.
Yeah. Before you get to an emergency situation. Yeah. Deborah, I wanted to come back to you because I know that you've been one of our WomenHeart Champions for several years now, as we've talked about. And you've spoken to countless numbers of women over those years about their heart health. What do you talk to them about in terms of their cholesterol in the bigger context of their heart health?
Yeah, so one of the things that I'm privileged to do is I host a support group. I'm in the Chicagoland area here, and I run a monthly support group for women. It's out of one of our local hospitals, but certainly open to anyone. And, you know, those are things that we talk about in our group. And so what I like to share with women that I've kind of learned from this is a number of things. The first, as doctor said, you know, get a cardiac screening, go to the doctor, say, hey, I was just on this Facebook Live presentation and it just reminded me I should go, you know, get myself evaluated for cardiac screening. Where am I on that risk factor?
Yeah.
You know what your risk factors are, your family history. Again, as Dr. mentioned, know your numbers, not just the total cholesterol, but the LDL and the HDL, because those are equally, if not maybe a little bit more important. And as doctor said, go to the doctor. You know, if you're not feeling well, go to the doctor. You know, I hear doctors say they love to be able to see a patient and say, wow, everything's looking good. You know, they like that. And then the other thing is, you need to be an advocate for yourself. Easier said than done. Women, you know, aren't always as, you know, comfortable maybe for advocating. But if you are feeling like something's not right and you go to the doctor and you're feeling not listening to you, you're feeling like you're being dismissed, you need to speak up, reach out to someone, get a second opinion. But you know your body better than anyone. And if you're feeling something just isn't right, I hear that from a lot of women in our support groups. They went to the physician and they were told they were having a panic attack or higher anxiety. And, you know, just don't let that go. Ask questions, you know, be an advocate in your own healthcare. Easier said than done, I know. And just a reminder is, you know, heart disease is the #1 killer of women. So,
Absolutely.
you know,
Yeah.
keep getting that message out. I know before my heart event, I think it was a little too, I was worried about breast cancer, right?
Mhm.
About my
Mhm.
breast. I
Mhm.
wasn't thinking about my heart. Well,
Mhm.
now I am, and
Yeah. Yeah.
everyone else should too. So,
Absolutely. How about you, Vicki? What words of wisdom might you have for women who are either you know timid about going to the doctor, or maybe experiencing some symptoms but haven't quite gotten them checked out? What would you advise them?
Right. Well, one of the things that, as a community educator with Women Heart, newly minted,
Yay!
I really want women to understand how to explain some of the symptoms that they're having, especially, when it comes to, for example, a heart attack. So men and women, studies have shown that they report differently. Men will just come right out and say, I'm having chest pain, I'm having pain on my arm, my back. Women, it seems, tend to explain things differently. I'm having some discomfort
Mhm.
in my chest or
Mhm.
maybe in my back. They don't really come out and say the words, I'm in pain.
Mhm.
And so that's, tying into this whole idea of heart disease, and also being your own advocate. If you're in pain, if something's not right, as Deborah said, you need to use those words, and you need to make sure people understand that you're in pain, because it does make a difference in the treatment that you can get.
Absolutely. Thank you so much, Vicki. And Dr. Gulati, I'll offer you the last word today.
Well, I think both these ladies have expressed it so well. So I'll just leave you with my last words of wisdom is, heart disease is the #1 killer of women, but lack of awareness is a close second. We can change that together.
Absolutely. Thank you so much. Thank you to Vicki, to Deborah, to Dr. Gulati, and thank you all for joining us today. We hope you learned something valuable about managing your own heart health. And for more information, please go to womenheart.org/cholesterol. Thank you all. Have a great rest of your day.